This conference will now be recorded.
So before going into this, will you answer for this? All are the derivatives of dorsal mesogastrium except what is the answer?
Lesser momentum. Lesser
Lesser
momentum.
momentum.
Lesser momentum.
Okay, good. Lesser momentum is the derivative of
Greater
Ventral
momentum.
mesogastrium.
Ventral mesogastrium.
okay, ventral mesogastrium. Okay. So next question, which of the following organ is secondary to peritoneal organ?
Duodenum.
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 Okay. So which part of duodenum exactly?
Second and third part.
Second and third part of the duodenum. All other organ are primary peritoneal organ. Okay. Only with the peritoneal cavity. So you know the space between the parietal and visceral layer. So here it is marked in red color and blue color. So this is the peritoneal cavity. So it is divided into greater sac, lesser sac. So both are connected by a vertical slit-like opening that is called the epiploic foramen. Okay. You can see this arrow mark is the epiploic foramen. Okay. This layer is the lesser omentum and this is the greater omentum. So the lesser sac is the space behind the liver, lesser omentum, stomach, and second layer of the greater omentum. Okay. Now vertical tracing essay itself I have finished. Do you have any doubt in the vertical tracing? Okay. So now I'll continue with the horizontal tracing. Okay. So before going into this, what is this aortic space here or pouch? This is the vertical tracing in female. You can see the rectum, uterus,
Vesico-uterine pouch.
Vesico-uterine pouch.
vesico-uterine pouch. Okay, good. So what about this pouch? Name of the pouch?
Recto-uterine pouch.
Recto-uterine pouch. Okay, good. Okay. So with this, we'll continue on to the reflection of peritoneum on the liver. This is the anterior view of the liver. Okay, you can see the falciform ligament here. Okay, so the reflection of peritoneum on the liver, it forms numerous ligaments. One is falciform ligament, other is the coronary ligament, then right and left triangular ligament. So you can see the falciform ligament here, which divides the liver into right and left lobe. After that, it divides into right layer and the left layer. Okay, see the next picture. So this is a sagittal section. You can see the diaphragm. This is in black color, and this is the liver. The green color one is the falciform ligament, and this is the inferior vena cava. So now falciform ligament is a sickle-shaped fold of peritoneum. Okay, so it consists of two layers. It connects the liver to the undersurface of the diaphragm and to the anterior abdominal wall up to umbilicus. If you see the attachment, actually this falciform ligament, it consists of convex margin. This margin is called as the convex margin, and this margin is called as the concave margin. So the convex margin is attached to the diaphragm and to the anterior abdominal wall. So the concave margin is attached to the anterior surface of the liver between anatomical right and left lobe. So this free margin extends from the umbilicus to the inferior border of the liver at the interlobar notch, and it consists of the ligamentum teres hepatis. Okay, clear about the attachment of the falciform ligament. So it has two
Yes, ma'am.
margin, convex margin, concave margin. Convex margin is attached to the diaphragm and anterior abdominal wall. Concave margin is attached to the anterior surface of liver between anatomical right and left lobe. and it has a free margin which extends from umbilicus to the interlobar notch, which consists of the ligamentum teres apparatus. So the shape of the falciform ligament is sickle shaped hole. Okay. So what are the other contents of the falciform ligament? The one is the ligamentum teres. So ligamentum teres is a remnant of what?
Left umbilical.
Umbilical
It is
vein.
left umbilical vein.
Left,
Umbilical.
left
Umbilical.
umbilical vein.
The ligamentum teres is nothing but the obliterator left umbilical vein. This actually in fetal life, this vein connects with the left branch of the portal vein. From here, the blood will be drained into the inferior vena cava. Okay. Now, what are the other contents? Other than ligamentum teres, here you have the paraumbilical vein, so which is a tributary of the portal vein. You can make a note on this point because I think this is not given in your book. Okay, and numerous small veins also present. They are called as accessory portal system of SAPI, so which communicate the paraumbilical vein with the diaphragmatic vein. So now the contents of the falciform ligament is number one is ligamentum teres, number two is the paraumbilical vein, okay, which is a tributary of portal vein, and third one is numerous small veins. They are called as accessory portal system of SAPI. Okay, so this communicates the paraumbilical vein with diaphragmatic vein. Okay, so clear about falciform ligament. Okay, now okay, I have typed here. Even you can copy this. Okay, I'll go to the next slide now. Okay, now you can see the falciform ligament. This is the falciform ligament. So you can see the ligamentum teres as its content. Now, if you trace the falciform ligament in the superior surface of the liver, it divides into right and left layer. So the right layer, it connects with the upper layer of the coronary ligament, the superior layer of coronary ligament, and the left layer connects with the lower layer of the left triangular ligament. Okay. Now come to the other ligaments. So in this picture, this is the posterior inferior view of the liver. You can see the bare area of the liver. It is bounded by the upper and lower layer of the coronary ligament. So both this on the right side joins to form the right triangular ligament. So this right triangular ligament connects the lateral surface of the liver to the diaphragm. Okay. So this upper layer of coronary ligament, if you see the previous picture, it is nothing but the continuation of the right layer of the falciform ligament. Okay. So this lower layer of coronary ligament, when you trace it on the left side, it goes along the undersurface of the inferior vena cava. Then it forms a margin of the caudate lobe. Then it forms the a layer of lesser omentum. Okay, so now this lower layer of coronary ligament is nothing but an extension from the lesser omentum. Okay, other end you can see the left triangular ligament. Okay, so now in the previous picture you can see the left layer of the falciform ligament connects with the lower layer of the left triangular ligament. Okay, and the lower layer actually which is joining to form left triangular ligament is an extension from the lesser omentum. Okay, so clear about the peritoneal fold forming surrounding the liver. Any doubt on this?
Man, I have a
Explain,
doubt
ma'am.
on the left triangular ligament, man.
Still, what's your doubt? So left triangular ligament you can see on the left side of the posterior surface of liver, that is formed by the, to see the previous picture. So this is a continuation of the left layer of the falciform ligament on the inferior aspect. The superior aspect you can see it is a upper layer of the lesser omentum. So both this forms the left triangular ligament. Okay, clear? So this left triangular ligament attaches the
Okay,
left
ma'am.
part of the liver to the diaphragm. Vatsala, do you have any doubt?
No, ma'am. It's clear.
Okay. Shall I continue?
Okay.
Okay. Now see the horizontal tracing about transverse colon. Okay. So you know now this is the falciform ligament. So this is the right side and this is the left side. This is the transverse section of the abdomen. So this space is for the liver and you can see the stomach. So now between liver and stomach, this is the lesser omentum. Okay. Now the falciform ligament right side actually, so we'll start from the left side of the falciform ligament. So this left layer of the falciform ligament actually it covers the anterior abdominal wall. Then it comes to the behind the spleen and it covers the anterior part of the left kidney. Then it forms a posterior layer of linorenal ligament. So this posterior layer of linorenal ligament again it covers the spleen and it forms the anterior layer of the gastrosplenic ligament. So this anterior layer of gastrosplenic ligament it forms the covering of the anterior covering of the stomach. Then it connects with the anterior layer of the lesser omentum. Otherwise, you can tell the tracing in this way also. The anterior layer of lesser omentum covers the anterior surface of stomach. It forms the anterior layer of gastrosplenic ligament. Then it covers the spleen. Then it becomes the posterior layer of linorenal ligament. Okay, after that covering the kidney, then it is reflected onto the posterior abdominal wall. Then it connects with the peritoneum covering the anterior abdominal wall. Then it forms the falciform ligament. Okay, you see on the right side, so the right layer of the falciform ligament after covering the anterior abdominal wall, it comes to the posterior abdominal wall, covers the right kidney, then inferior vena cava. Okay, it covers the aorta, then it covers the left kidney and it forms the anterior layer of linorenal ligament. Then it covers the posterior surface of the stomach. Then it forms the posterior layer of the lesser omentum. Okay, so clear? So horizontal tracing will be little bit difficult. Okay, just you have to follow the picture. Shall I continue? Okay. Now you see this. This is the horizontal tracing of the peritoneum below the level of transverse colon. This is a picture of the posterior surface of the anterior abdominal wall. So here the you can see the parietal peritoneum. It forms 5 folds. So this is the urinary bladder. So this fold formed in the median plane is the median umbilical fold. So under this you have the median umbilical ligament. It is a remnant of urachus, and you can see 2 lateral folds. That is 2 folds lateral to the median umbilical fold. That is called medial umbilical fold. That is formed by the umbilical artery. Then lateral to that you can see lateral fold. This lateral fold is formed by the underlying inferior epigastric artery. Okay, so clear?
Yes, ma'am.
So you can see the folds in this picture. This is the median umbilical fold, medial, and this is lateral umbilical fold. So in between the median umbilical fold and medial umbilical fold, there will be a depression that is called supravesical fossa. Between medial and lateral umbilical fold, this space is called medial inguinal fossa. And lateral to the lateral umbilical fold is called lateral inguinal fossa. Okay. So that's all about the tracings. Next we'll go on to the lesser sac. Okay. So you know already what is lesser sac. Lesser sac is otherwise called as the omental bursa. Okay, since it lies behind the stomach, okay, it allows the expansion of the stomach. That's why it is called omental bursa. So it is a bursa which lies behind the caudate lobe of the liver and the posterior layer of the lesser omentum and a peritoneum covering the posterior surface of the stomach and the second layer of the greater omentum. So this space is called as the lesser sac. So along the right free margin of lesser sac, you have a that is right free margin of lesser omentum. You have a vertical slit. That slit is called epiploic foramen. So through this slit, lesser sac communicates with the greater sac. Okay. So now you know the location of the lesser sac. So if you see the boundaries of the lesser sac, it has an anterior wall and it has a posterior wall. It has a lower margin and it has an upper margin and it has a right margin and left margin. So in this picture, you can tell the anterior wall. The anterior wall is formed by the peritoneum covering the caudate lobe of the liver and caudate process of liver. And as I said already, the posterior layer of lesser omentum. Then next will be the peritoneum covering the posterior surface of stomach and the second layer of the greater omentum. So this forms the anterior wall of the lesser sac. Okay. So then next, if you see the posterior wall, so this is the third layer of the greater omentum. Then the peritoneum covering the transverse colon, transverse mesocolon. Okay. And the peritoneum covering the pancreas, then splenic artery, so left kidney, left suprarenal gland, and diaphragm. So now the posterior wall, in simple, you can tell the structures which are forming the stomach bed is forms the posterior boundary of the lesser sac. Okay, in the next picture you can see. So you can see the stomach here and the greater omentum. This is the transverse colon. So after removing the stomach and the greater omentum and after removing the transverse colon, okay, this is the transverse colon. So this is the transverse mesocolon and this is the duodenum. You can see the pancreas here. This is splenic artery, left kidney, left suprarenal gland. So these are the structures forming the stomach bed. Okay, now the peritoneum covering all these parts will form the posterior boundary of the lesser sac. So in sagittal section you can see. So the first one is the third layer of greater omentum, then peritoneum covering the transverse colon. So this is mesocolon, transverse mesocolon. Then the peritoneum covering the pancreas, splenic artery. There comes the left kidney, suprarenal gland, then diaphragm. Okay, so clear about the anterior wall and posterior wall. Any doubt do you have here? Okay. Now you can see in this picture. So the green color one is the lesser omentum and this is the stomach. So the arrow mark shows the position of the lesser sac. Okay. Now after remove of this, you can see the complete lesser sac here. Okay. So these are the structures forming the posterior wall of the lesser sac. Okay. And what is this structure?
Celiac trunk.
Celiac.
Celiac trunk. Okay. So what about this branch of the celiac trunk?
Splenic artery.
Okay. What about this?
Common
Common
hepatic artery.
hepatic artery.
Common hepatic artery. What about this?
Left gastric artery.
Left gastric artery.
Okay. The left
Left
gastric artery.
gastric artery.
Okay. Okay. Now, actually, this is the cadaveric image. Next image is schematic diagram. Okay. So just see after removal of the stomach, you are seeing the remaining structures. You can see the celiac trunk. So this is the left gastric artery, splenic artery, and this is the hepatic artery. Now, the left gastric artery and the hepatic artery. So while on its path, it is covered by a peritoneal fold. So it forms a fold of peritoneum. So these folds are called, on the left side, left gastropancreatic fold, which is formed by the left gastric artery. On the right side, so right gastropancreatic fold, which is formed by the hepatic artery. Okay. Now this two folds, that is left gastropancreatic fold and right gastropancreatic fold, divide the lesser sac into in two areas, one above the fold and another below the fold. Okay. Then another space which extends into the spleen, which is called splenic recess. Okay. Now the space above the fold is called superior recess. The space below the fold, the space is called as the inferior recess. The space which extends over the spleen is called as the splenic recess. So these are the subdivisions of the lesser sac. Okay. So clear about the posterior wall boundary and how the lesser sac is divided into three parts. Okay. Now come to the boundaries of the right margin. Okay. So now the right margin is formed by the epiploic foramen. Okay. So other than this, you will get the peritoneal reflection from diaphragm to caudate lobe here. Okay. And even you can tell the right margin is formed by the peritoneal reflection of neck of pancreas. Okay, so this is the right margin. Exactly is the epiploic foramen and the peritoneal reflection from diaphragm to caudate lobe. Okay, so if you see the upper margin is formed by a reflection of peritoneum from diaphragm to the liver. Okay, so this is the right margin, this is the upper margin. Okay, I think you all understand this diagram. This is again a sagittal section. This is liver, this is the lesser omentum, this is stomach, okay, and this is the greater omentum. You can see the transverse colon, transverse mesocolon, and duodenum, pancreas. So now this space is called the lesser sac. So clear about right margin and upper margin. Okay. Now see the left margin. So actually the left margin is formed by two ligaments. One is the linorenal ligament, and other one will be the gastrosplenic ligament. Okay, so this is the left margin of the lesser sac that is formed by linorenal ligament, or it is otherwise called splenorenal ligament, and next one will be the gastrosplenic ligament. So, and the lower margin is formed by the right margin of the greater omentum. Okay, so in the previous picture you can see, so this is the lower margin. It is formed by the right margin of the greater omentum and the reflection of peritoneum over the neck of pancreas. Okay, so clear about the boundaries of the lesser sac. Any doubt in this? Okay, shall I continue?
Okay, ma'am.
Okay. In this picture, you can see the superior recess, inferior recess, and splenic recess. And this foramen is the epiploic foramen. Okay. So it resembles hot water bag. The omental bursa, it resembles the hot water bag. So so this is the superior recess. So how will you divide the lesser sac into recesses to superior and inferior? Which fold divides? Which fold divides this into two. See this picture and tell what is the name of this fold.
gastric acid.
Yeah, left gastropancreatic fold. What about in the right side?
Right gastric
Right
pancreatic.
gastro.
Pancreatic fold. Okay. Okay, now see the superior recess and the inferior recess, and this is the splenic recess. Now come to the epiploic foramen. What is the epiploic foramen?
It connects
It is
The lesser.
Connects the
connects with
greater sac
with
to the lesser sac.
Greater and the lesser sac.
okay. So it is a vertical slit-like opening through which the lesser sac and the greater sac communicates. Okay. So it lies behind the right pre-margin of the lesser omentum. This green color arrow is the epiploic foramen. What is the other name for epiploic foramen?
Foramen of
Foramen of Winslow.
Or you can tell it is opening to the lesser sac. Okay, now see the schematic diagram of the epiploic foramen boundaries. Okay, now first understand the diagram. So this is the porta hepatis. This is the right pre-margin of lesser omentum, which has three contents: bile duct, hepatic artery, and portal vein. Okay, so below this you will have the first part of duodenum, and here is the caudate lobe of liver with the caudate process, and behind this you can see the inferior vena cava, right suprarenal gland, and T12 vertebra. Now actually the epiploic foramen is here, it is like this. Okay. Okay. Now the anterior boundary is formed by the right pre-margin of lesser omentum, which consists of bile duct, hepatic artery, and portal vein. The posterior boundary is formed by the inferior vena cava, right suprarenal gland, and T12 vertebrae. Superiorly, it is bounded by the caudate process of the caudate lobe of liver. So inferiorly, it is bounded by the first part of the duodenum. Okay, it's clear about the epiploic foramen boundaries. Have you all seen this in the cadaver? I'm not getting any response. I think all of you are sleeping.
yes.
No, ma'am.
Yes, ma'am.
Yes, ma'am. No, ma'am.
Ma'am.
Okay. Okay, I'll continue with the next slide. We'll go into the greater sac. Now the greater sac is the space other than lesser sac is called as greater sac. Okay. Now this greater sac is divided by the transverse mesocolon into supracholic compartment and infracholic compartment. So this supracholic compartment consists of stomach, liver, and spleen. Infracholic compartment consists of small intestine, ascending and descending colon. Okay. This infracholic compartment is again divided into right and left half by the mesentery of the small intestine. Okay, now we can just see. So supracholic compartment is the part above the transverse colon. Okay, infracholic is part below the transverse colon. So the supracholic compartment has liver, spleen, and stomach. Infracholic has the small intestine, ascending and descending colon. Okay, now we'll see about the supracholic compartment. It is also otherwise called subphrenic spaces. So it has the intraperitoneal space and extraperitoneal space. So the intraperitoneal fossa, there are four. So we are dividing the intraperitoneal space into the space below the diaphragm and the space below the liver. So the space below the diaphragm, we call this space as subphrenic space. So you have right and left subphrenic space, and the space below the liver is called subhepatic space. So this is also, there are two right and left subhepatic space. So the right subhepatic space is otherwise called hepatorenal pouch or Morrison's pouch. The left subhepatic space is otherwise called as lesser sac. So there are intraperitoneal space of 4 in number. So right and left subphrenic space and right and left subhepatic space. So next will be the extraperitoneal space. There are 3 extraperitoneal space. If you know the name, that is enough. Here, so right extraperitoneal space, left extraperitoneal space, midline extraperitoneal space. Okay, shall I continue? Okay. So
Yes,
see
ma'am.
this picture. Okay. So now this again the sagittal section. You can see the liver. So this space under the diaphragm is called subphrenic space, and this space under the liver, this is called subhepatic space. Okay. So now this is the right subhepatic space and this is the left subhepatic space. The left subhepatic space already we have seen, that is nothing but the lesser side. Okay. So you can see in this picture the falciform ligament here. Okay. So divides the right and left subphrenic space. So the part on the right side of falciform ligament is right subphrenic space and the left side is the left subphrenic space. So this is the transverse section of abdomen. And see the right subhepatic space that is between the liver and the right kidney. And this left subhepatic space is otherwise called lesser sac. Okay, so out of these 4 spaces, lesser sac, this and say question are important 5-mark question. So next important thing is the hepatorenal pouch or Morrison's pouch. It is also otherwise called right subhepatic space. Okay. So hepatorenal pouch. So that means it's between the liver and the kidney, right kidney. Okay. So what are the boundaries of the hepatorenal pouch? Okay. So actually anteriorly it is bounded by the right lobe of the liver, or you can say posterior inferior surface of the right lobe of liver, and posteriorly will be the right kidney. Superiorly you will have the inferior layer of coronary ligament, and inferiorly it opens into the right parabolic gutter. Okay, so these are the boundaries of the hepatorenal pouch. Okay, so anteriorly by right lobe of liver, posteriorly by right kidney, superiorly by inferior layer of coronary ligament, and inferiorly it opens into right parabolic gutter. Okay, so clear about hepatorenal pouch? Okay, so you can see here. So on the right side, this hepatorenal pouch is limited by the diaphragm. On the left side, this hepatorenal pouch, it communicates with the omental bursa. Okay. So this hepatorenal pouch is the most dependent part of the peritoneal cavity in lying down position, and it is also the most common site of subphrenic abscess. Okay, clear about hepatorenal pouch? Okay. So come to the infracolic compartment. So far we have seen the supracolic compartment. So the infracolic compartment is the part of the abdominal cavity below the transverse colon. So this part is the infracolic compartment. So the infracolic compartment is again divided by the mesentery, the root of the mesentery, attachment of root of mesentery into right infracolic space. Yellow color one is the right infracolic space and the blue color one is the left infracolic space. So other than this, the space just on the lateral side of ascending colon is right parabolic gutter, and on the lateral side of descending colon is the left parabolic gutter. Okay, so clear? So this right infracolic space is closed on all sides. This triangular in shape, the apex is directed downwards here. If you see the left infracolic space, it is an open space, it communicates with the pelvic cavity. Okay. So in this picture, you can see the right and left parabolic gutter. So right parabolic gutter is on the right side of ascending colon. Left parabolic gutter is on the left side of the descending colon. Okay. So clear about the other spaces of the peritoneal cavity. It is mainly the greater sac. supracholic compartment and infracholic compartment. Now come to the two important pouches. One is the vesicouterine pouch and rectouterine pouch. Okay. So this rectouterine pouch is also otherwise called, this is again the sagittal section. The rectouterine pouch is also otherwise called pouch of Douglas. Okay. So this is the most dependent part in the standing posture, that is in the upright position. Okay. So if you see the boundaries of the rectouterine pouch, anteriorly it is bounded by the cervix. That is, this portion of the cervix is called supravaginal portion of the cervix, and the uterus, and posteriorly by the rectum. So inferiorly by a fold of peritoneum. So this fold of peritoneum is called rectovaginal fold of peritoneum. After covering the rectum, so it folds anteriorly. So this bend is called rectovaginal fold of peritoneum. So this forms the inferior boundary of the rectouterine pouch. If you see the distance of the rectouterine pouch from the anus, it is about 5.5 centimeter. Okay. So in males, you don't have rectouterine pouch. So there you have rectovesical pouch. So the distance of the rectovesical pouch from the anus is about 7.5 centimeter. Okay. So clear? Usually the infected fluid will collect commonly in the rectouterine pouch, and in case of any ectopic rupture of ectopic pregnancy, the fluid will accumulate in the rectouterine pouch. So next is the vesicouterine pouch, that is between the uterus and the peritoneum, covering the superior surface of the urinary bladder, base and the superior surface of the urinary bladder. So now inferior boundary is formed by vesicouterine fold of peritoneum. This fold is called vesicouterine fold of peritoneum. To clear about the boundaries of the rectouterine pouch and vesicouterine pouch.
Yes, ma'am.
So as I already said, this is the most dependent part in sitting or standing position, and this is also most common site of pelvic abscess in females. So this is the picture of the rectouterine pouch. So this portion of the uterus is called anteverted portion. Normally the uterus will lie like this in the pelvic cavity. You can see the urinary bladder. So the uterus will lie over the urinary bladder. So this portion of uterus is called anteverted and anteflexion. So now this pouch is the rectouterine pouch, and this is the rectum. Anal canal. Okay, this opening is the anus here. And this is the vagina. Okay. So in males, this pouch is a rectovesical pouch. So this is a male pelvis, section of the male pelvis. So here uterus is absent. Okay, you can see the rectovesical pouch. So other than this, there are numerous peritoneal recesses are there. So they are nothing but the small spaces of peritoneal cavity within large peritoneal. So this is a large peritoneal cavity. In this you can see small canals. So like this you have the small peritoneal recesses. So usually they are guarded by holes which contains blood vessels. So if you see the names of the peritoneal recesses, lesser sac, duodenal recesses, fecal recesses, and other than this you have intrasigmoid recesses. So already you have seen the lesser sac. You'll see the next duodenal recesses. So this duodenal recesses are present around the fourth part of the duodenum and duodenojejunal function. So according to the position where it is located, it's named as superior duodenal recess, inferior duodenal recess, The recess which is behind the fourth part of duodenum is called retroduodenal recess. Then close to the duodenum is called paraduodenal recess. And one more is there, that is duodenojejunal recess. Okay. So these are all duodenal recesses. So next will be the cecal recess. So this picture is the cecum with terminal part of ileum and appendix, and this is the mesoappendix. Okay. Now you can see the fold which connects the cecum to the ileum. This fold is called ileocecal fold. Okay. Now you can see the superior ileocecal recess here and inferior ileocecal recess. The recess behind the cecum, that is called retrocecal recess. Usually the appendix, the commonest portion of appendix is the retrocecal portion. So clear about cecal recess? Okay. So will you answer for this question? This is the most dependent peritoneal space in lying supine position.
Pouch of Douglas.
Pouch of Morrison.
Pouch of Douglas.
Pouch of Morrison is the correct answer. Actually, in sitting and standing position is the
Pouch of Douglas.
the most dependent peritoneal pose is pouch of Douglas.
Douglas.
Okay. You know answer for this second question.
Left suprarenal gland.
Left suprarenal.
Left suprarenal gland. Left suprarenal gland.
Okay. Answer here is the left suprarenal gland. So all other structures forms the posterior boundary of the epiploid.
Epiploid foramen.
Right suprarenal gland and T12 vertebrae. Okay. So if you see the applied aspect, actually the applied aspect related to lesser sac is usually the strangulated hernia will be there in the lesser sac. So that is approached only through greater momentum. Because what is the reason means the right femur of lesser momentum consists of important structures. There is bile duct, portal vein, and hepatic artery. If you approach through epiploic foramen, there is chance of injuring that structure. So the best approach is through greater momentum. Okay. And posterior gastric ulcers sometimes perforate into lesser sac. From there, through epiploic foramen, the fluid will accumulate in the hepatorenal port. Okay. And if you see the referred pain of the foregut will be in the epigastric area, and midgut will be in the periumbilical area, and hindgut will be in the suprapubic area. So the appendicitis pain, referred pain will, where will you get? Appendix is the derivative of the midgut. So where will you get the pain of the appendicitis?
Periumbilical area.
Periumbilical area.
Yeah, actually the umbilicus is supplied by T10 segment of the spinal cord. So the same segment only supplying the appendix. So you can see the referred pain in the periumbilical area. Initially it will be localized around the right inguinal region, but the referred pain will be seen near the around the umbilicus. Okay. What is this condition called as?
Ascites.
Ascites.
Yeah, this is ascites. That is pain,
Ascites.
accumulation in the peritoneal cavity. Okay. So this is the ascites. You can see normal peritoneal thing and fluid in the peritoneal cavity. So this condition is called ascites. Usually the ascites will be associated with cirrhosis of the liver. Okay. So these are the sites of paracentesis. Okay. So 3 centimeter medial and superior to the anterior superior iliac spine is the commonest portion of paracentesis. The next portion will be just below the umbilicus. Okay. So paracentesis is removing of the fluid from the from which place?
Peritoneal cavity.
Not only peritoneal cavity, paracentesis thoracis is also there, paracentesis abdominis is also there. So paracentesis thoracis will do in pleural effusion cases. Okay, abdominis for the ascites. Okay. So the peritoneum, you know, actually we can use this for the peritoneal dialysis. Okay. And for actually this accumulation of CSF in the ventricles of the brain, okay, this causes so in that the ventriculoperitoneal shunt can be done and the fluid will be evacuated through peritoneal cavity. So this shunt is called ventriculoperitoneal shunt. This is done for hydrocephalus case. Hydrocephalus. Cephalus means superior. Okay, the fluid accumulation in the ventricles of the brain. So for that, we can do the ventriculoperitoneal shunt. That means, so fluid from the brain will be evacuated in the peritoneal cavity. So in the peritoneal cavity will absorb the excess fluid. Okay, clear about the applied aspect? Do you have any doubt? Okay. So with this, I'll finish the slide. I hope you understood because today all of you are very silent. I think you people are feeling sleepy. Many of them left in the middle also. Okay. So if you have any doubt, you can come and approach me tomorrow.
Thank you.
Okay. And you can
Thank you, ma'am.
you can send your feedback
Thank you, ma'am.
through WhatsApp. Okay. So tomorrow or day
Thank
after
you, ma'am.
tomorrow, I'll give a feedback form. Just fill it and give it to me. Okay. So with
Yes,
this,
ma'am.
I'll finish. Thank you.
Yes, ma'am. Thank you, ma'am.
Thank you,
Thank you.
ma'am. Thank you, ma'am.